Select venous setting. Turn on the center line and procedure mode. Ultrasound machines are outfitted with these cases and the code is 000. Inside the cases are pre-packaged Ziploc bags with all the gear you'll need, including flushes and IV catheters. Use non-sterile ultrasound gel and the linear probe to identify a target vein. Wipe down the arm and the probe. Let both dry. Chloropreps are included in the start kit. Use that to clean the arm. Apply a thin layer of ultrasound gel over the top of the linear probe and place Tegaderm. If you use too much ultrasound gel, you'll never get the Tegaderm to stick and you'll have to start over. Remove sterile packet of gel from Ziploc bag, open and squeeze onto arm. Set out all supplies from the ultrasound kit so that you're ready to start the semi-sterile procedure. Here, our ultrasound faculty is using the transverse method to start an ultrasound guided IV. Catheter is at 30 degrees to the skin. On the right, you can see the tip of the catheter and the lumen of the vein, and the center line is appropriately positioned over the vein. He then uses his left hand to slide the probe proximally up the arm, and each time relocating the tip of the catheter and the lumen. This is the inchworm technique. He then rotates the probe to the longitudinal axis to visualize the catheter in the vein and making sure that he hasn't backwalled the catheter through the vein. Confirms placement again, moves the catheter slightly up the vein, sets the probe down and slides the catheter in place. Occlude the vein proximally with the left hand and attach the pre-flushed extension tubing to the catheter, draw back to visualize blood, and then flush the line. Note that if you're drawing blood, you would connect the 10 cc syringe directly to the catheter, draw the blood, and then attach the extension tubing. You can use the probe to confirm the placement of the catheter in the vein. Here you can see the small circle as he moves proximally up the arm, confirming placement. You can also use the longitudinal axis to visualize the same thing. Here, this reassures you that you have not backwalled the catheter. I realize you're stoked you got your ultrasound guided IV placed, but you really need to take the time now to use the gauze included in your pre-packaged Ziploc bag to clean the skin thoroughly before you attach the Tegaderm. If you don't do this, Tegaderm won't stick and you'll lose your IV. Make sure to remove the tourniquet before you place the Tegaderm secure as seen in the video. The next technique is the longitudinal orientation for placing the IV. You use the same angle of the catheter at 30 degrees to the skin. Several of our faculty actually prefer this over the transverse method. It can be useful in situations where you definitely don't want to backwall the vein, such as placing a central venous catheter in the IJ with the artery right below it. Here you can see he's moving his left hand back and forth to make sure that the vein is oriented appropriately in the screen, and you can start to see on the left side the needle coming into view in the lumen of the vein. It's just starting to poke through now, and there it is in the vein. You can make sure 100% that he is not backwalled as he slowly advances it forward while flattening out the catheter. There'll be times when you want to draw blood while placing the ultrasound guided IV. You'll need two 10 cc syringes. You'll attach them directly to the catheter hub and draw back the blood. Either call phlebotomy on Vocera or ask the nurse to help you with that. You'll want to hand off the blood directly to the phlebotomist. At that point, you'll proceed as before and attach the pre-flushed extension tubing directly to the catheter. Last but not least, be sure to clean the ultrasound machine by removing the Tegaderm, wiping it down with the green or gray but not purple wipes. Turn off the procedure mode, close the top of the ultrasound machine, but do not turn the machine off, and then plug the machine in.